for part 1 of our journey, please check the description box below. Good morning. Right now I am heading downtown. I have an appointment with the fertility specialist. I was supposed to have it at my normal location in the suburbs by me, but my doctor apparently is in the hospital. I hope she's okay. I don't really know what's going on, but she's really ill. And so they asked if I would be willing to go to the downtown location, which isn't super far from me, to be honest, but it's just during rush hour. But just a little traffic, but that's not a big deal. So today's procedure is it's a saline procedure, so I think I've talked about it maybe briefly before, but it's basically where they're just going to take saline and flush my uterus with saline, and then they're going to tell me if there's any abnormalities going on, why I may be not getting pregnant or not sustaining pregnancy right now. So we shall see. Everything else so far has come back clear, so there's no real answers yet, and we'll see what happens with this one. I know it's going to be painful. I don't know how painful it's going to be, and I was supposed to take ibuprofen before I left, but I was so frantic, just trying to make sure that I left the house with plenty of time, I completely forgot my ibuprofen. So if I have time when I get down there, I might pick some up from Walgreens or something, or if not, I might ask them if they have any, So I just left my appointment, and so from the looks of it, they're gonna talk to my doctor just to confirm everything, but from the looks of it, my right fallopian tube is potentially obstructed or closed, and you don't need 2 working fallopian tubes to get pregnant, hence me having a child and a miscarriage, but it's not ideal. So we're gonna see. The nurse practitioner is going, so we'll see. The nurse practitioner is going to be calling my doctor to review all of the results from the ultrasound and the photos and everything, and they're gonna get back to me later today. They said if for some reason they're not able to, they're gonna get back to me on Monday, and we will see how that all goes. And basically I am in a lot of pain and cramping a lot from the saline, but we'll see if they make me do a dye test, which will be another similar test but more painful, and that's been talked about, and the other thing that was talked about was just pursuing treatment anyway, because I do have one functioning fallopian tube. So I'll let you guys know as soon as I know any more. I'm just trying to stay positive, and I'll get back to you guys ASAP. Okay guys, I'm just checking in with you. It's pretty early in the morning. I'm heading over to my fertility clinic, and today they are going to do a scan of everything, make sure that we are good to go this cycle. And if everything is okay, then I will start taking my Letrozole today, which I will take for 5 days, and then we will have our first IUI and hopefully our only IUI. And so sometime within the next like 3 to 4 weeks, I should know if we're pregnant or not. So fingers crossed that everything goes smoothly today. And you know, we've just had a really stressful go for a little while. We've had a lot of stuff going on, and it's just time. It's time for us to be able to get a hold of things in our life again. And I just really am looking forward to this appointment today. For the first time, I'm going in, you know, hopeful. So let's hope everything goes really well. Okay, so just checking in with you guys. I'm waiting for a call back from my doctor after my appointment this morning. We went in to check on the progress of the follicles. So I don't know what I had mentioned before, but I had been given a prescription for 5 days for Letrozole, or otherwise known as the brand name from Femara. It is originally a breast cancer drug that helps with hormones. However, it was discovered that this drug also helps with fertility. And so they are using it for me because in my specific case of PCOS, they said that it's more likely that I'll respond better to Letrozole than to clomiphene or Clomid, which a lot of people use Clomid. So I took 5 days of Letrozole. I had the weekend off, and then on today, Monday, went in for an ultrasound and a blood work. I'm waiting for my results back. So we want to make sure that there are enough mature follicles that I will at least ovulate 1 egg, but not too many, so that like I won't ovulate like 6 eggs. So if we get the all clear, then we will have 48 hours until our IUI, and if we don't get the all clear, I may have to wait a couple days, or they may say that we have to cancel this month if there's too many, or if there's something fishy in my blood work or ultrasound that they need to check out. So I am just hoping that we get the all clear. I'm hoping that we have like 1, 2, 3 follicles that will equal 1, maybe 2 eggs. I really don't want more than that because it may be too risky for them to proceed if there's more than that. And at this point, I just want to get pregnant. And so fingers crossed that I get that phone call soon and that we're all good to go. I'll check in with you guys ASAP. Okay guys, so I got my call from my nurse, and I have to go back in on Thursday because my follicles aren't quite mature enough. They want them to mature between 15 and 23 millimeters. Mine are 10.4, 9.7, 9.8, and 9.3 on the left, and I have 1 on the right that's an 8. But the right is the side where my tube is blocked, and there's only a 10% chance that that even would get out. So I'm not counting on that one, but the other 4, which is good, because she said if those 4 get to 15 to 23, then they have an 80% chance of producing an egg. And so she said we'll probably get between 1 to 2 eggs out of it. But if for some reason there's 3, then they will double check with me to make sure if we want to proceed or not. Just because there's that many eggs doesn't mean that there will be that many babies. So we just have to wait and see, and we'll see if we get an egg that gets fertilized, maybe. So hopefully by Saturday, we'll be going in for IUI. All right, guys, I'll keep in touch with you guys on Thursday and let you know how that appointment goes. Okay, guys, I'm checking in. I don't have too much information. I just got out of my appointment over at the fertility center, and I don't think that I'm going to be doing IUI on Saturday because basically the ultrasound tech was like, she's like, wait, are you still taking the Clomid or the Letrozole? And I was like, no, I took Letrozole last week and like I've been done with it. And this is the second time I've gone in to check my follicles, and last time the biggest one was at 10, and she said like, and when my nurse called, she said like they wanted it at least 15, but more ideally 18 to 22. And so I was hoping to be like at a 15 minimum today, and for my biggest one at least. And she said that my biggest one is a 12. And she's like, they might make you go on Letrozole again to like pump it up. Which sucks, because Letrozole makes me super moody. And it not only does it make me super moody, but it gives me really bad headaches, which also makes me moody. I'm just really... It's hard. This whole fertility thing is hard, guys. It's like, I just keep getting kicked back down. Like, I keep trying to keep my positivity up, but I keep getting kicked back down. It's like, the odds are just against me, and it's like so frustrating. I feel like if I backtrack to a little over a year ago, you know, like started this entire journey this time with a false positive on a pregnancy test, which then led to months of weird period problems, issues from a steroid injection, issues from taking the anxiety medication I was trying to take, like other issues. You know, my periods were coming literally like every couple of days. I would only get a few days in between. Then finally, you know, I got my periods to spread out enough that I got pregnant, got so excited about being pregnant, and like had a whole to-do about it, and then had a miscarriage. Went to the fertility clinic finally, you know, like after all of these things, found out that I have all of these problems, PCOS, possible endometriosis, a closed tube, like all of these issues against me. Still there's hope, you know, like let's keep going, and then go the drug route, go the IUI route, like the medicated IUI route, try it all out, and then like I'm still not, like my follicles aren't growing fast enough, my lining's not growing fast enough. It's a lot, guys. It's a lot. It's hard. It's really, really hard. If you've never had to be through this, like I'm so grateful for you, because going through pregnancy alone is really, really hard. Like pregnancy is really hard, and I've done it, and I know that. And like, I didn't particularly enjoy pregnancy itself, besides the fact that like it gave me my daughter. It was really painful for me, and I had a lot of problems, especially towards the end of my pregnancy. The beginning of my pregnancy, I was so exhausted, I could barely do anything, and the end of my pregnancy, I was in constant pain. So pregnancy wasn't my favorite thing, but like it brought me my daughter. Now I'm trying so hard to get pregnant, and I can't. I feel like I'm just gonna look at it a little differently this time. Even if it's painful and all of that, I think I'm just gonna be grateful the whole time, because this is so freaking hard. I'm sorry for ranting and complaining, and anyone out there going through this, I'm so sorry. I'm here with you. I know what it's like. Today I went to get my blood drawn, and my left arm that I let them pull the blood out of normally, like looks like a heroin addict. Like I have bruises. So I had to be like, can you just use my right arm today? Because my left arm is just not up for it. Anyway, I don't know. I'm struggling. It's really hard, and I have good days and bad days. And I was recently talking to someone else I know who's been through this, and you know, basically we said it's either you're hopeful and you're ready to go and you're, you know, positive and all of that, or you're completely the opposite and you're negative and you're anxious and you're feeling terrible. And there's not really an in-between when you're going through this. Like, there's no gray area. You just, either you're positive about it or you're negative about it. Right now is a hard day for me. So, well, I just want to be pregnant and I just want this all to be over. It's not that easy. And I was really hoping to do IUI on Saturday. It was actually going to work out really well if we could do IUI on Saturday, because I'm working downtown in the morning, 10 minutes from their downtown location where we would need to go. Ryan's already home from work on Saturdays, and my mom said that she would babysit for us. So, like, it was going to work out really well, but I don't think it's going to happen. So now it's probably not going to happen until next week, if it happens at all. Okay, so I just got off the phone with my nurse, and now they're saying there's 2 on the right measuring 9.5 and 9.1, which before I only had 1 on the right measuring 8, and now there's only 2 on the left measuring 12 and 11.3. But a couple days ago I had 4 on the left that were at, you know, from 9 to 10, and, you know, a couple in between there. So I guess like 2 of them didn't continue to grow, or I don't know what's going on, and which is frustrating because my right side is the side that the fallopian tube is blocked, and there's only a 10% chance that an egg from that ovary can get over to the other fallopian tube to get through. So those 2 on the right are very unlikely to make it through. So I'm just hoping that the 2 on the left will mature because this is starting to suck. This really sucks. And I'm gonna go back in on Monday, and they're gonna recheck me, and if they're not growing, they're gonna put me on Letrozole again. And if they spontaneously did grow a lot, then you know, I'll be lucky and we can do the IUI Wednesday. So morning, guys. It is dark. It is snowing. It is very cold. But I'm heading into my appointment, and I am hoping that today is the day. It's always something with me. Starting to become very irritating. Last check was on Thursday, and I had a follicle that was at a 12. They wanted that to grow to a minimum of 15, but they really wanted to see it between 18 and 23. Today, my biggest follicle, over 3 days later, is a 10. That's smaller. Shrinking is not what I want to see. I'm gonna get a phone call from the nurse later today. She's gonna be explaining to me, like, if I'm just assuming they're gonna put me on another round of Letrozole, or Femara, which is the name brand. So just it's very frustrating. It's very frustrating to feel like it's just another setback. It's just another and she said that, like, there were a few that were 9s and 10s, which is exactly where we were last week. I've had 9s and 10s since last Monday, and every time I go in, when she's looking at my follicle growth, she's saying things like, remind me where you are in your cycle. Are you taking the Letrozole now? Or are you baseline? Which is what she said last Monday when I went in for my first ultrasound after taking 5 days and having 2 days off. She said, are you baseline? Which worried me to begin with. Because no, I wasn't baseline. It was 5 days and then 2 days waiting in between. And then the last 2 times I've gone in, she's asked me if I was stemming. And no, I'm not, because I'm not taking the pills right now. And like, that's so frustrating to hear, because it means that like my entire insides like aren't operating properly and aren't working on the right schedule, even with the medication. So, good morning. This morning I am headed back to the doctor. Today is day 5 of my second round of Letrozole. This one has been at 5 milligrams. Last couple weeks ago was at 2.5 milligrams. I'm slightly concerned because last week I had, sorry, there's like a little kid crossing the street going to school. Last week I had cramping, and or earlier in the week, I guess that would have been Sunday, that I had cramping. And then on Monday they did my levels, and they said like that they didn't think that I would have ovulated or anything because my hormone levels were low, and that the two I had 3 actually, 2 on the left, 1 on the right, and they had like shrunk. The follicles had shrunk. So they put me back on the Letrozole in order to try and convince those follicles to grow. And so that's where we're at right now, is like me kind of working on these follicles to grow. So today's day 5. Because it's a Friday, I'm going in for my ultrasound this morning, even though I don't take my last 2 Letrozole pills until this evening. But they don't do this type of ultrasound work and blood work stuff on Saturdays and Sundays. So they do have a different location I've been to once. It's downtown. I've been going to the suburbs location, but the downtown location is open on Saturdays, but they're only open for like certain procedures like IUI. The reason I went there was when I got my saline procedure, but they don't do like regular blood work and ultrasound on weekends. They just do like the big things. So they wanted to get me in on Friday to check the progress of everything. The reason that I probably don't sound super like thrilled right now is because this morning I had like sort of like discolored discharge. Like it almost looked like, I don't know if some of you ever get this before your period starts, like the day before your period starts, you might get like a little bit of kind of pink, or like, I don't know how to describe the color, but it is kind of pinkish, I guess, but also kind of like light brown. I don't know, but it's just a like slightly different colored discharge than your normal like clear or white kind of color. So I am just like a little bit concerned that my body's not taking to the Letrozole, and that like maybe my period's about to start. Which with this stuff, like it's all trial and error, and like they pick the one with the best odds based on your like situation. And with PCOS, like Letrozole has the best odds. But that doesn't necessarily mean that like my body chemistry is going to get along with it. So, we're working on figuring that out. It's just like, it's just always something. Like, it just sucks. God. It just really, really sucks. Like, it's one thing, and then it's the next thing, and then it's the next thing. And, you know, meanwhile, my life is like going on, and I have to continue to like show up. I'm a mom. I have to be there for my daughter. I have to take care of her. And no matter what, like, I keep getting knocked back down, but I have to pull myself back up and get back up again, because I don't get to like wallow in self-pity and sorrow like I want to. Like, I want to just like lay in a bed and cry and let myself deal with whatever's going on. But I don't have the ability to do that because I have a kid. And so I like, please do not take this in any way, shape, or form of me not being appreciative of my daughter, because she is everything in my life. And I am so lucky to have her. I actually read an article that someone I know sent me, who's gone through similar situations. And she sent this to me, and it was directed about secondary infertility and how complicated secondary infertility is, because there's a lot of conflicting emotions involved. Infertility is difficult no matter what, but it's different problems with equal severity, I guess, is the way that it kind of would be described. Like, secondary infertility, you have different issues that you're dealing with and different things that your brain is trying to make sense of that are difficult. You have successfully created a child, gone through it all on your own, and so it's confusing because you don't understand why, if your body worked right the first time, why isn't it working right now? And it's very difficult to wrap your mind around something like that. Like, what is wrong with me now that I'm having this much trouble? And it's really difficult for me to not have any control. I want to be able to say I have control over this situation. I'm going to find a way to make it work. But every time that I do try and find a way to make it work, more roadblocks pop up. And it just feels like I continuously keep getting knocked back down again. And I'm just praying that this is not my period coming. Because if it is, it makes things very difficult. You don't know till you know. If I could wish that no one in the world would ever have to go through this, I would. Plain and simple. Okay, so I won't know more until I get my call from my nurse. Per the usual, I'm sure you guys know the drill by now. I have probably said that like 10 times in this video. Okay, so my ultrasound tech told me that I have, my biggest one is a 14 right now. Is good, means we're growing, because Monday we had shrunk down to a 10. We had a 12 and then we shrunk down to a 10. So the fact that we are back up to a 14 is really good. They wanted to see at least 15, but they wanted, like, ideally to be 18 to 22, 21, 23. I don't remember. You think I've heard these numbers enough times, I would remember. But we're at a 14. My lining's only at a 5. She said she has seen women get pregnant all the way as low as a 4. It's not ideal to have a softer lining or a lighter lining. You know, they like to see it really fluffy and plush and ready for implantation, but she has seen it as low as a 4 as people getting pregnant, and so she said that it still may grow a little bit more, but a 5 is fine. She would rather see it at like a 6 or 7, I think she said, but it's okay. So that being said, I am sure they're going to make me wait a little bit longer, although the follicles can grow 1 to 2 centimeters. Oh my god. The follicles can grow 1 to 2 millimeters a day. And so the follicle could be ready, you know, in the next couple of days. I have 2 more Letrozole pills to take tonight. So we will see how that works. My ultrasound tech also said, like, just based on my lining, that like maybe next, if this one doesn't work, then the next time they might try a different approach, because they want me to have a thicker lining or whatever next time if this time doesn't work. So I don't know if that'll mean Clomid instead of Letrozole, or I know there's like gonadotropins, but I don't think that they would give me those because that's like a very high chance of multiples with I think it's called gonadotropins. If I'm pronouncing that wrong, please let me know, but I don't think that I am. But we'll see. Everything's a waiting game. It's just a waiting game. It's a lot of hurry up and wait, hurry up and wait, hurry up and wait. And I am just wanting to be getting the IUI, and then I want the 2-week wait to be over her, and I just want to be pregnant. So if only things were that simple, but I'm not getting my hopes up because I don't know, got a lot going on. So we'll see. We shall see.